You can try this, but these are little bobas.
Oh, I hate those.
I do too.
Why'd you get?
Hold on.
Wait,
listen.
where's mine?
I do too. You drink my Red Bull.
I know.
I got me and Daisy breakfast this morning while you guys were having a meeting. But try it. These bobas are. Oh, hello. Pineapple and mango boba, and they're not like normal boba. They still pop.
They shoot up the straw.
Yeah, bro, it's a boba.
Guys,
straw.
boba, so gross. If you have a chance to have boba, don't do that.
But they handed this to me, and it was like all separated into colors, and it looked like a rainbow in a cup.
Oh,
like,
that was for you.
So perfect.
Rainbow in a cup.
And Daisy got her mango matcha. We're not technically. I mean, we're live.
We're not technically live.
No, you are live.
Oh, we're both live, but we go live 5 minutes early so people can log in and feel like
don't
they're.
Don't say anything dumb right now, please.
Well,
anyway,
we actually
those
did.
bobas are good.
Oh, I don't think so.
You didn't know I was going to shoot up a straw.
Yeah, I didn't know they shoot up a straw like that.
How do you think the straw's that big?
That's a
This
really
is-
good point.
This is
Is that all boba tea? Has those balls in it?
boba tea will have.
I did not know that's what that meant. That's so
Yeah,
gross.
And then they give you a boba straw so that you can get to them.
Oh, that is so gross. What's the point?
Well, this is a lemonade with extra caffeine since you drink my Red Bull.
What's the point?
I mean, you did buy my Red Bull. But
I know, but I drank the last one.
it was delicious.
I don't have caffeine usually. So if you're watching this, so I'm a little bit hyped up and jazzed on caffeine right now.
Dr. Emett is really excited to talk about.
But I stole her Red Bull this morning. It's good though.
It's really good. Watermelon ones
It's
are
pretty good. Pretty good. I'm wearing a size smaller shirt
You shouldn't be wearing a size smaller shirt. Look at
That's
you
what I
looking all
told him.
fit.
because I now fit in one.
Because all week we've been telling you look like you're wearing.
Well, I
like,
put on a regular scrub top today, and Bailey goes, "Dad, you look like you're wearing your dad's clothes."
Yeah. It was the V-neck was like
That's what
so
like it was like down here.
yeah, it was so V.
That's a little bit too much
He
chest
said,
hair.
He said, "What do I look like?"
So-
And I said, "Like you're wearing a tent."
little too much chesties from
A
Dr.
little
Emett.
too much chest hair. Don't need to show all that.
Well, look at that. How do you feel in your smaller scrub top?
All right. What's funny is
Looks nice.
it's still the same size as the other ones. It's just like a different cut or
Is that
different
what
like
it is?
run. Well, it was a different like run
Timmy, will
Different
you
lot.
move his mic down since he pulled his shirt up?
Yeah,
on
just
his
pull your
shoulder?
just pull your shirt.
because I
Pull
bought.
your shirt down.
No, it goes down here. Because I bought them and they showed up, but they would never fit. They were too tight. So it's been in the back of my closet. And today I was like, I think I'll try one of those ones.
And it's great.
Thanks so much.
Looks great.
Somebody
Now
just
we gotta
barely was-
talk about your pants. No, I'm just kidding.
Somebody was just barely on Facebook. They're like, hey, I tried to log in and it wasn't working. It was from 2 hours ago. And I'm like, 12 o'clock
12 o'clock
PST.
PST.
Then
We
push on.
are in Las Vegas.
Then click on his
I
face.
tell people that all the time.
We get all these people that are like, oh, I tried to get on your event. I couldn't do it. I missed it. And I'm like,
You didn't read
You
it.
didn't
there's
miss
more
it.
than one
You
time
didn't miss
zone.
it.
We have to go live every hour on the hour for 4 hours. And then we could always be at noon PST. Or we could always be at noon, I mean.
I was gonna say
And
not.
yeah,
We'd start at
so
8 a.m. and do a live from 8 to 9, 9 to 10, 10 to 11, and 12 to 1.
hit all the
And then
Eastern,
everybody
the
would always be able to
Midwestern.
show up for it and see it on time.
I vote
We could
don't
do that. Or
That just got vetoed, didn't it?
or
Curtis
we could-
from Kingman, Arizona here. Hi.
Yo, what up,
What's
Curtis?
Curtis?
Curtis from Kingman.
I think we're seeing Curtis.
I don't know.
We might be.
I don't talk
We
about that
may-
stuff.
We may or may not be.
We may or may not recognize names that come through these.
Someone's knocking on our door.
That's a Bailey problem.
Come on,
All right.
we're live.
Please hold. We are.
Hello, hello,
so-
Shirlene.
What's up, Shirlene? So we do these lives from the office. This is just
Oh, yeah.
our consultation room.
Who are we?
Well, we're not even live yet.
We're
I'm
live.
telling you, this is behind the scenes stuff for these people. Oh, we're live. So we do these lives from the office, but somebody's knocking on the front door, which is locked because we're
I
not really working Friday.
I really hope it's a package from the lab.
I really hope it's pizza or tacos.
Pizza or tacos would be way better.
So it is noon. We'll go ahead and start. So good afternoon, everybody. Nice to see you here. I'm Dr. Emett.
I'm Tiffany, Dr. Emmett's assistant.
I want to talk about that. And we are in Las Vegas. We are a platinum 3-on-6 provider.
Yes.
What does that mean?
It means that you do lots and lots and lots of 3-on-6.
Yeah.
Actually, it's the only thing we do at our office.
See, all we do, 3-on-6. We
it's
don't
not
do
how you
anything
become
else.
a platinum provider, but at our office, it's all we do.
Yeah.
So, what was it? A
Oh,
Sam's
good.
Club box? Oh, it's the protein shakes. It's the protein
So,
shake. Is it a big box? It's the protein
All we do
shakes.
is 3-on-6 at our office. That's it. And so we go live every other Friday, just like this. Shirley and
Right.
Wilson, great. I'm in Las Vegas. Cool. Well, we're here too.
Why are you sitting up so far?
I don't know.
I feel like I should sit.
Yeah. And so every other Friday, we go live for an hour and we address a topic.
Yes.
So there's lots of questions we get submitted throughout the week for the topic. We take compiled questions and we go live and then we answer live questions. So the topic for this week is what?
Maintaining your 3-on-6.
Spoiler, it's written right there.
It is how to properly maintain your
Yeah.
3-on-6. A lot of times our topics come from the questions, and sometimes we just have like a list of topics that we need to cover.
Yeah.
And so it works out really great. I think this was one of the ones that we had a lot of questions about.
That is true.
So the girls decided we need to talk about this.
And there's a lot of overlap. I mean, we have, by the way, we have 880 videos now on YouTube. Is that right, Bailey? Or are we at 900?
I thought we.
I have to take down so we're at 661.
All right, whatever. We're like 700 videos that are live
We're
on.
at roughly 700.
Yeah, we have 700 videos that are on YouTube. We've covered every topic that you can think of. And so sometimes we feel like, man, we feel like we say that a lot, but it's always to a different audience.
Yeah.
So if you're here for the first time, or maybe you already have your 3-on-6, or you are just getting started on your 3-on-6 journey, just know that this is a safe space. You can ask your question. I'm holding this toothbrush.
There is no dumb question.
There's no dumb question.
Yeah.
And so there's some dumb questions. No, I'm kidding. But we have a list of questions. We're going to go through those today. And we're just going to do our best to discuss the topic, answer your questions, and just help you become educated about full mouth reconstruction, specifically as it relates to the 3-on-6. But I feel like we answer questions every week about all on X, dentures and snap-ins and partials. Our goal is always just to help you get the best thing possible.
Yep. It's the education behind
Yeah.
it.
That's right. So we are in our office here in Las Vegas.
We're in our
This is our
consultation
background
room.
that's here all the time.
Mhm.
The staff gave me that sign
For your birthday.
for my birthday, I think.
Was
So
it?
I got it in February.
Yeah.
One of
And
my
then you and
favorite
I put these
things.
tiles up.
Yeah. Really
By the
pretty,
way,
right?
if you ever want tiles, we do side jobs.
Side
We
hustle.
We
Tiles.
put tiles.
I don't think so. So anyway, let's get started.
We do require beer and lots of giggles. As we put
Yeah, we're gonna have a good time doing it.
Mhm.
Okay, so the topic is how to properly maintain your 3-on-6.
Yes.
And I want to start at the very, very, very beginning. And I want us to talk about like literally the first night.
I was like, there was light and
I
how
want to
far back are we going?
I want to start on the first night, what a patient does for their 3-on-6
We're talking about the first night
of
after
surgery. Yep. And then I want to go all the way through up to 6 months.
Okay.
So
First
you're,
night.
I'm going to ask you one question. You're going to ask me the next question.
Okay.
Okay. So I'm going to ask you, what does a patient need to do to maintain their 3-on-6 the day of surgery? So you've had surgery. You woke up, you feel drunk, you feel groggy, you feel all the things. You went home. What do you need to do that night?
Not really.
Yeah.
You can brush your tongue and rinse your mouth, but you don't really need a brush. You don't just.
Do you
leave
think
it alone.
will your mouth taste gross?
Yeah, that's why I'm rinse.
Yeah.
Rinse, brush your tongue. A lot of bacteria that causes bad breath actually lives on your tongue and lives on the back of your tongue, like way back.
Way back there.
So yeah, we always recommend patients get tongue scrubbers and stuff like that. But
tongue scrapers.
scrapers, there are scrubbers.
I know there's
too.
scrubbers,
They're
but a
really
tongue
cute.
scraper.
I have to use a scrubber. The scrapers make me.
I like the
gaggy.
scraper. So you
Yeah.
can use so the first night of surgery, you go home,
Mhm.
and that first night, I don't care if you brush your teeth or not.
Yeah. But also, we like our patients to start using their Stella Life. We want you to put your Stella Life gel on. There is a Stella Life rinse that you can use, but if you don't do that the first night because you're groggy and you're sleepy, just eat something and go to bed.
Pretty low
Eat
expectations.
something, take your medications,
Yeah.
go to bed.
That's it.
Totally fine.
Okay, so next
Next
morning
day.
you wake up.
Yes. You can brush.
I'd like you to brush your teeth before
Yeah.
you come see me.
You can brush.
So if you had 3-on-6 surgery last night,
Mhm.
in my office, you're always going to see me 24 hours later or
Next day.
the next day, whatever. So you woke up after surgery, you've got your teeth, you slept, you wake up the next morning, your breath's going to be pretty nasty.
Mhm.
You've
Yeah.
still been having some light oozing and bleeding.
Mhm.
You probably ate some mashed potatoes and applesauce
And protein shakes
And
got delivered by Sam's Club.
and some protein shakes. that we gave you, by the way.
Yeah.
We give you all
Give
of
you a
this
whole
stuff.
Go pack.
Especially if you flew in to see us. I think this is something kind of fun that we do. If you flew in, which 80% of our patients do,
Yeah.
they're not from Las Vegas. Now, believe me, Charlene, we love that you in Las Vegas. We have a lot of patients from here too, but most of our patients have flown in, and at the hotel room, waiting for them when they check in is this basket,
I think
a bag.
Yeah, I think it's a bag.
Correction.
You can see how often we drop this off.
I've never done it
Not
once.
very often.
So there's a bag.
I have picked up prescriptions, given them to Daisy, to then
That's
take
true.
to the hotel.
So it typically would have prescriptions and that stuff in it, but it has some mashed potatoes, applesauce, protein shakes, just some stuff you can eat that first night. Because the first night you're on a liquid only diet.
Sometimes we put their ice packs in there.
Ice packs, that kind of stuff.
All
So
that stuff ready to go.
next morning,
Brush your teeth.
you can brush your teeth. Now, I want to show you with what. We've given you this toothbrush.
Show them to the grammars as well.
Several of these. We give them 2 of these toothbrushes?
2 or 4. I don't remember.
We give you some.
I think we do 2 because you're only going to use it for 2 weeks.
Yeah, we give you some of these. Now, guys, this is like really, really super duper soft.
If you look it up on Amazon, I think these have like 1,000 bristles or something.
Yeah,
They're
like
ridiculous.
1 trillion.
Soft. Yeah.
Bailey, will you show that to the Instagram folks? Hi, Instagram. We didn't forget about you up there. You're just on a separate camera this time again.
Charlene, if you're in Vegas, you still get the bag.
You still get it. We just give it to you.
I'm supposed to click on it. I'm supposed to click on it. So if you're not in Vegas, you don't get a basket. You still get your bag. You just get it the day that we do your smile design appointment, and you take everything with you. As far as like your applesauce, your mashed potatoes, we give that to the person who's taking you home that night. So yeah,
you still get it.
You still get all the things. You still get all the things. It's just not delivered to you.
Yeah, it's just not waiting in your hotel room.
Yeah, yeah.
Okay, so super soft toothbrush. This is what you're going to use for the first 2 weeks, actually.
Correct.
So the morning of surgery, when you wake up, I want you to brush your teeth. Why not your gums?
They're kind of beat up.
They're sore.
They kind of went through a
lot yesterday.
They went through a lot the day before. So yeah.
So it'll be a lot to have to brush your gums.
You're not going to hurt anything by brushing them because this toothbrush is so soft.
Right.
But
well, that's why we give that to you.
It's not necessary to start brushing your gums yet.
Yeah. So you wake up that morning, brush your teeth. Real easy, real light. Hey, what kind of toothpaste should they use the day after surgery? And do we give them the toothpaste?
We give them toothpaste to use.
Okay.
Yep, we give you toothpaste. We give you Closest toothpaste to use.
Closest.
Closest is an antimicrobial
Good job.
Toothpaste.
Yeah.
Which basically just means it helps with all the bacteria.
And it has tons of fluoride, right?
There's no fluoride. So that's what's fun is there's no fluoride. You no longer have enamel. You no longer need fluoride.
You don't need fluoride on your 3
So we
on
tell
6.
patients all the time, use whatever toothpaste you like.
Yeah.
I use bubblegum flavored SpongeBob toothpaste.
Yeah.
Actually, I heard that they discontinued the SpongeBob one, and I'm like,
Oh,
I
that's
don't
lame.
want it then if it doesn't have Patrick Star when I squeeze it out of the tube.
So morning of, brush your teeth, brush your tongue, come see us.
Yes.
We've already talked about what we do at those appointments. We don't need to belabor that today. And you're going to use this toothbrush for 2 full weeks.
Yes.
Now, during that 2 weeks, you can get a little bit more aggressive with it. You can start to tease your gums a little bit. You can start to work on your gums a little bit. But how many times a day do I require you to use this toothbrush?
At least 2. The requirement is 2.
At least 2 times per day.
Yeah.
You've got to use this toothbrush.
Yes.
And then there's also, so now let's say you've gone your first 2 weeks.
Yes.
Okay. So the first 2 weeks, you're
Good job.
only.
You made it through the hardest part.
Yeah, you've made it.
Yay.
You're only brushing your teeth, though. You're not doing any other adjunct.
Just brushing.
You can use the Stella Life gel.
You can use the
that
Stella Life
stuff.
mouth rinse.
But you're not doing anything else.
Correct.
Now, let's fast forward to 2 weeks.
In 2 weeks.
Introducing.
And at our office, you're going to get a text message 2 weeks after surgery. It's going to say, hey, so-and-so, it's time to switch up your toothbrush and it's time to start using your water pick.
Where do they buy this water pick?
Oh, they don't have to at our office. We send it home in your goodie bag.
You don't have to buy it. We give it to you. Even if you live in Las Vegas, we give it to you.
Especially if you live in Las Vegas. When at our office, when we say it's an all-inclusive thing, it truly is. Everything is included, except for your prescriptions. We can't actually technically.
Sometimes we'll pick them up for you, but you're
pick
still
them
paying
up, but you
for
still
it.
have to pay for
It's like $40.
Yeah, we do generics.
Okay, so now you've been 2 weeks since surgery.
Yes.
You're maintaining your 3 on 6, and you're starting with the water pick. And you'll notice the water pick has different settings. It goes everywhere from 1 to 10. Hold that up for the
grammars.
grammars.
They can see it.
Instagram, can you see that? All right.
I was ready to stand up and help.
So 0 to 10 or 1 to 10. So on week number 1, so you've been out 2 weeks after surgery, the first week you start to use this, what setting do they start it on?
I just did first notch.
Yeah, first notch.
First
level
little
1.
notch.
Why do we have them start on level 1?
Your gums are still healing.
Yeah.
This is a very gentle setting, but you're going to blast out so much stuff that you didn't even know was living in your mouth.
Tons of gunk.
Tons and tons of
Because you've
gunk.
gone 2 weeks with kind of some gunk building up. There's food, there's
Mhm.
bacteria, there's debris,
Mhm.
there's blood, there's remnants from surgery, and you're going to use this thing for the first time. And if you're not used to a water pick, you're going to squirt water everywhere, all over the mirror, whole bathroom.
Everywhere.
My best advice is stand right next to the sink, lean over the sink, and put this in your mouth and use it. We're going to show you how to use it right now. But you're going to use this water pick now how many times a day?
2, morning and night.
At least twice a day. Bailey's answering the question in
Does
the
it-
background.
Does it
She
matter?
can't stand that there's questions she doesn't get to answer.
Does it matter if they use it before or after brushing?
Does it matter if you use it before or after brushing?
I had a patient ask
I
me
don't
that
care.
the other day, and I was like, oh. They're
I
like,
don't
well, will my toothbrush get stuff out, then my water pick won't? I'm like, nope.
No.
Your water pick will get stuff out.
Yeah.
Your toothbrush didn't.
There's no particular order.
Mhm.
I water pick and then brush. You could brush and then water pick, and it makes zero difference.
Yep.
So so if I just tell patients, hey, go use the water pick and don't tell them how, I've had patients that are like trying to shoot it from back here, like angle the water into their mouth.
Get it in there.
Guys, that's a mess from hell. Sorry, I
Mhm.
swear. Bailey just looked at me like, don't swear. Sorry, it makes a big mess.
Makes
all
a
right.
really big mess from here to breath.
When you use the water pick, you actually touch it right here between where the teeth and the gums are, and you run it right along this interface right here, all the way across on the outside and
on the inside.
on the inside.
I think the inside is the trickier one to do.
Yeah,
It
a
is
little bit
for
more
me anyway.
dexterity to try to do the inside. And as a technicality with this, do they only do it 1 tank full of water?
Oh, no. So keep going until your mouth rinse is clear. Like till
Well,
it rinses clean.
When they first start, it's going to cause some
Go
bleeding.
until it rinses clean.
Guys,
not bits and pieces. If there's a little bit of that stuff that I think if we say too many times we might get a censorship on it. The
Blood?
BLOOD.
we can say blood.
You can say blood.
We're not gonna get
You can
censored.
say blood.
I was like, ooh.
So when you first start using the water pick for the first couple of days, it's going to make your gums bleed.
And
It's
that's
okay.
okay.
It's normal. Everybody gets that. So which tip do you use on the water pick?
We like this guy.
This is the tip right there.
It comes with I think 4 or 5 different tips. This is the guy.
Yeah, there's like these little brushes,
Yeah,
these
they're
little
like
rubber
little
bits and all this
brushes.
stuff. Just use this one.
Yeah.
It's totally fine. And then they increase the water pick 1
1 notch.
setting every week until they get to what?
6.
So you get up to
Going
6.
level 6.
So that'll be 8 weeks after surgery, 6 weeks after using the water pick. And they use it at least 2 times per day.
Yes.
I want it to be every morning and every night. But what you'll hear almost all the time,
Yeah,
patients use it all day long.
Every patient.
You can't
Yeah.
use it too much.
No.
So people are like, oh, I can't stand it now that I'm used to a water pick
Mhm.
and I have lunch. I got to clean it out.
Yeah.
So you'll find yourself using the water pick multiple times per day. That's totally fine.
A lot of our patients will buy a handheld one so that when
Yeah.
they're out and about, they can still use it. We have a lot of patients who are flight attendants. I know they have handheld ones for when they're flying and things. But this one, just so everyone knows, the one that sits on your countertop is so much more powerful
Yeah.
than a handheld
And
one.
easier to use, I think.
Yeah, so don't just switch to a handheld one. They just don't have the guts that the one on the countertop does.
Yeah. Okay. I think we should take some questions real quick.
Okay.
I'm just going to click on them because we're supposed to click on them now so everybody can see it. Curtis from Kingman, Arizona. Hi, everybody.
What's up?
Yo, what's up?
Curtis?
Hello.
Everyone said hello.
Hey, I'm in Las Vegas. Hey, us too. Hi, Curtis. Let's see if there's a question here. Oh, so if you're from Vegas, you don't get a basket. You still get a basket.
You're
Sorry,
shaking-
I
you're
make it shake.
shaking the world right
Okay,
now.
you be the clicker.
Ooh.
I wanted information on it. I had my teeth pulled in December. I hate the dentures.
Yeah,
I haven't been wearing them. Charlene,
that's
I
very,
can't
very
make this
common.
up. At least once a week, somebody's in my office with their dentures. They hate them and they don't even wear them. I say it's like having a size 11 shoe on a size 6 foot. You're not alone. And we take patients all the time from dentures into a 3-on-6. So
We did that this week on Wednesday.
let's do this just for Shirlene.
We did that on Wednesday.
We did on Wednesday. My patient this week went from a denture to a 3-on-6. Shirlene,
Contact us.
that's how to find us.
702-710-9006. And also, please make sure to be
Follow
following
us.
us on all of these platforms.
Yeah, so that's how to get an appointment. Listen, my office is closed on Fridays. We're here on Fridays,
Yeah.
but functionally we're closed on Fridays. All of my patients,
Also, we don't answer the phone.
we shouldn't answer the phones. But every one of my existing patients has my personal cell phone number.
Correct.
So if a patient needed to get a hold of me on a Sunday at 2:00, you still could.
Yeah.
But when you're not a patient yet, you'll need to call the office. But we'll be here first thing Monday morning.
Yeah.
So we get here at 9
If
o'clock.
you call and leave a message, or even if you go to our website, alloutdental.com, and fill out the little form, Daisy or Amelia will call you on Monday.
That's true. Okay.
100%.
Next
And
comment
then
or
we
question,
have
whatever somebody
Barry
said.
that says, "Hi, group."
What up, Barry?
Hello, Barry.
Barry McCullers.
And then
What's this one?
Daisy.
You read it.
And you go one up each week after there until you reach 6, and then you never more than 6.
So on the water pick, you can go up to 7 or 8 intermittently. Like if you got a little stubborn
something
bunch of gunk
stuck.
up here around somewhere,
Mhm.
turn it up a little bit and blast it out.
Yes. Lynn says, "Is it possible to water pick too rough and create pockets in the gums?"
Not really.
Nah.
Gums
You-
respond to stimulus. So the more you use it, it's great. But
The water pick itself is not abrasive.
it's not strong enough. It's not going
Yeah.
to blast away your
It's
gum
not- it's not
tissue.
abrasive, so
It'll cause a little pinch. Like even my gums, I've had it up on the highest. I'm like, ooh, I felt that.
Yeah.
That caused a little pinch.
you know that
So-
spot I have on this upper side that I've been told to watch.
Yes.
I blasted it the other day, and I was like,
Got a
I
little
almost
food
called
out of
you.
it.
Yeah, I almost called you. I'm like,
I have a food trap in my mouth.
can you come look at this?
The staff hates it when I go like this and run air
It's
through it,
his,
like nervous
it's
tick.
your nervous tick.
Yeah.
Yeah.
And
He does it.
sometimes I blast that out and that'll get a little pinch. But yeah, you're not going to cause damage.
Charlene says, "Okay, got
Got
it.
it. All right. We'll
Let's
see you
go
soon,
to
Shirlene.
Barry, what are the chances of infection after surgery?"
Ooh, let's break this down individual questions.
Okay. What is the chances of infection after surgery?
Listen, you've had a
Low, but not
major
zero.
oral surgery.
Mhm.
I put every patient who it's not contraindicated for onto an antibiotic.
Mhm.
And I can count on less than one hand
Yeah.
how many patients have had an actual postoperative infection out of hundreds for a 3-on-6. It is
I can think of
extremely,
2.
yeah, it's extremely uncommon. When it does happen, it's very localized
Yeah.
typically,
Like one specific.
and it's easily addressed. So I don't know the actual chances after a 3-on-6 surgery.
Low, but not 0.
Yeah, it's a non-zero chance, but it's like less than 1% or something. It'd be or less than, yeah,
It's very, very
it's
low.
very, very low.
Yeah.
Is it 3-on-6 is the top and bottom row. So traditionally 3-on-6, you do your top and your bottom arch at the same time. In the last 3 years,
Mhm.
I have had 6 patients total,
Which is so funny because by the end of the year, you'll have to say like 10.
10.
Yeah, it'll be
We have a
like 10.
couple that are coming up right now. I've had 6 patients total who have done one arch or the other. We talk about this in a lot of our videos. There's a lot of limitations to that. But it's most traditionally done top and bottom same time.
Yeah.
What if you have like mid-level gingivitis? How do we treat all that? And does it go away? And can you reconstruct guidelines?
Gum line.
Gum lines, I
Yeah,
bet.
gum line.
Barry, 99% of patients who have a 3-on-6
Have had.
currently have periodontal disease, gingivitis. I mean, that's one of the causes of soft tissue inflammation and bone loss, which leads to needing full mouth reconstruction. So that's very, very common. What's cool is in one surgery, we open up your gums, we take it all out, it's all gone. So it's all dealt with at the same time.
It's a reset button.
Yeah, it's a reset
Yeah.
button.
You get to reset everything.
Can you reconstruct,
restructure
gum line? Yes, every day.
Every single
Do it
day.
every day. All right, next question. That was off topic, but I got you, Barry.
He just said gum line. So
Yeah.
yes.
All right.
Yeah.
So if
Got
you're, yeah, we got you. Okay. That was all those questions. Okay. Now let's talk about how you're maintaining your 3-on-6 between the 2-week mark and the 4-month mark. You're up.
Brushing at least twice a day.
Okay.
Using your water pick at least twice a day. Going up one notch every week until you hit 6.
And then just stay at 6.
stay at 6.
Okay.
Yeah,
That's it.
that's it. You don't need to floss. There's nowhere to floss.
It's nowhere to floss. Don't you dare floss
Um,
these teeth.
Yeah, we had a patient that was putting floss underneath their bridges. Please don't do that.
Yeah.
Don't do
Don't
that.
floss.
Don't floss.
Flossing is not helping anything. And don't break your attachment of your
From your
gums
gums.
onto your bridge.
Mhm.
That's important.
Yep.
So yeah, if you are brushing and flossing twice a day,
Mhm.
keeping your mouth clean, using the tongue scraper, just keeping your mouth clean, that's all you got to do as far as the maintenance.
Yep.
What about a night guard? I think we should bring that up.
Yes, yeah. So we send our patients home with a night guard. They need to start using it.
A week after
I would
surgery.
say we tell patients usually about a week after surgery.
Yeah.
But when you make it, it's a boil and bite night guard. You put it in really, really hot water. You take it out, put it in. It only goes on top. You don't need it top and bottom, just top.
Yep.
You kind of suck all the air out of it and mold it to the teeth. And then you're going to cut off anywhere that's touching your gums. It's just
Why?
for the teeth. It doesn't need to touch your gums.
Why?
Plus, the more it touches your gums, it's going to cause a little sore on
irritating.
your gums. It's so irritating.
It can hurt you. It can just feel
Yes.
uncomfortable on your gums.
Yeah.
So just cut it off.
Just cut it off. You don't need
Scissors.
it.
Easy.
Yep. Yeah, they're super soft.
Oh, question
Awesome
coming in from
We
Instagram.
had a Facebook question that I missed the other day. You know how you post and you say write questions below?
Oh yeah.
We have one. Do you want to do it now or do you want to do it?
I'll do it in a minute. Let's do it in a minute. Let's get through to the next point. So we have some more questions coming in through other places, but we'll get to them. Okay. What else do I want them to do during the, and then your job during the 4 months of healing is if something doesn't feel right,
Yeah.
call
Call the
me,
office.
tell me. Don't let me be the last to know. A patient came in one day like, well, my bridge has been broken for a couple of weeks. I just didn't want to say anything because I knew I had an appointment coming up.
Yeah.
Listen, I don't want you to go around with a broken bridge. Just call me.
Or
Tell me
patients
what's
come
going
in
on.
like, yeah, this side hasn't felt right since a couple weeks after surgery.
Yeah.
Please tell
If
us.
something doesn't feel right, let us
Say
know.
something.
So that's really your only job for the next
You're
2 to
not-
4 months.
You're not bugging Dr. Emmett. I promise. You're
It's my
not
job.
bugging
I
him.
chose this job, so it's totally fine.
And our patients, we want you to use your Stella Life gel
Till it's
until
gone. Yep.
You don't need it after that. Just use it till it's gone.
All right. So now we've gone from I had surgery to I came in for my 4-month appointment.
Mhm.
Let's just assume that everything went perfect at your 4-month appointment
Mhm.
and we're taking you right into your finals. So let's fast forward to finals day. You just got your final teeth.
Yes.
And this starts the timeline of what?
still maintaining it.
Well, yeah, you're 6 months though. I was trying to trick you into
Oh,
saying
I was
6
like,
months.
you're still maintaining it. But yeah, the next time we need to see you is at 6 months. Or the next time you need to be seen by a dentist
Is
we'll
6
get to
months.
that,
So
but is in 6 months.
let's go over all this. So you got your final teeth. Your
Ooh.
final teeth are made out of zirconia.
Mhm.
So
You're off the soft food diet. You can eat whatever you want.
yeah, now you're
Yay.
on a regular food diet, which means you're going to start eating some regular food.
Mhm.
You're going to go out here and want to eat pizza and steak and eat corn on the cob and
Mhm.
bite ribs and
apples,
apples,
apple,
everything normal teeth can do.
popcorn, and-
Your teeth are doing, which means you're going to get some food stuck in your teeth now. That's totally normal. So your maintenance doesn't end.
No.
You got your finals. This starts two things. It starts your regular experience of teeth, but it also starts your 6 month like interval countdown, right? It started.
Right.
So let's talk about this now. When you have a 3-on-6, your gum tissue is your own gums. Your
Mhm.
teeth are touching right into your gums.
Mhm.
So when you're using your toothbrush and your water pick, you have to make sure you're going around the front and the back on the inside. Now,
top and bottom.
top and bottom. When patients come in to see us for their cleanings every 6 months, where is the number one place they get buildup?
The lower teeth on the back side.
You almost
of
said
your
lower
lower
lingual. I know
front-
you wanted to
know,
say
I
all the
was saying
right
The
words.
lower teeth, it's the back side of your front teeth.
Do we have a
that is-
lower?
No, there's not a lower in here.
No, I only have a-
I
Pretend.
only have uppers in here.
Well, hand me that model right
I
there.
have lower in room 2.
Or we should get Frank.
Oh, where's
I'll
Frank?
Go get Frank. I have a model called Frank. There's not a guy here named Frank. We're gonna get the model that we nicknamed
We should have
Frank.
a guy named Frank. No, we have a model named
Go
Frank.
get Frank.
He's our.
So we're gonna
soul model.
show you how to properly brush your teeth. Oh wait, something we didn't talk about. No, you go get the model. At 2 weeks. So you've been using this toothbrush for 2 weeks.
Yeah.
But what happens at 2 weeks?
No, we talked about it a little bit. You switch to a regular.
You
soft
switch to a
toothbrush.
regular toothbrush
And if you
that
are
we
from
give
our
you.
office, you have it in your bag.
Yeah. So this is only for 2 weeks. This super soft one.
Yeah.
After 2 weeks, this is too soft. It's
Yeah.
not going to do a good enough job cleaning your teeth and your gums. So you got to switch to the regular soft toothbrush.
Soft toothbrushes. You do not
And you'll
need
use
a
that same
medium.
one for the rest of your life.
You do not need a hard toothbrush.
Same style. Don't
Yeah.
use the same toothbrush
Yeah,
the rest of your
please.
life. Same
Here's
style.
Frank. Oh, let's put
He's
Frank's jaw back on.
disconnected.
We'll hook
Well,
Frank's.
let's
hook his
Frank
face back
up.
together.
There you go, Frank.
Okay, so the number one place that patients get buildup when they come in to see us is on the bottom, on the inside.
And not just our patient,
Everybody.
everybody that has natural
Yeah, it's
teeth.
very common.
It's the most common place.
So the only toothbrush I brought in here was the soft one. I didn't think about it.
This is Frank.
So
We love Frank.
the number one place people get buildup in their mouth on Frank is
Backside.
down. Wow, that
Now-
spring is
now we-
strong.
Now we need to dislocate his jaw again.
Take his teeth off. Take his jaw off. All right. It's right down here on the inside.
Mhm.
That's where you get the buildup. So if you're only brushing your teeth like this, and you turn the toothbrush over and try to go back here, you never get down in the spot you're supposed to go.
Nope.
The only way to clean the back of those bottom teeth, you got to turn the toothbrush up like this,
Mhm.
almost like
So
it's
maybe
straight
there's
up and
kind of-
down in front of your face, and we have to go up and down like this.
I have to tilt my head down a little bit. I don't know why.
Lots of up and down brushing. You got to get underneath all those back teeth.
Yes.
And that's the only way to clean down there. And that's the number one mistake patients make is they're so used to holding a toothbrush sideways and they turn it and they think, oh, I'm getting behind these teeth down here.
You're
You're
always
never
gonna
going to
miss it.
make it.
Always gonna miss it.
Turn that toothbrush straight up and down in front of your face and up and down all the way here across the,
And you'll
back of
probably
those teeth.
still get a little bit of buildup down there. It's
because
just
everybody does.
Everybody does.
So it's going to happen.
I'm obsessive about, especially right there. I'm obsessive about it.
Because you
and I
clean
still-
people's teeth.
Yeah, and I still get that buildup. So
Okay.
it's just the most common place to get buildup.
So
Your tongue's just not super helpful.
I have said
Keeping everything against it.
multiple times 6 months.
Yes,
Why is 6
6
months
months.
significant?
Because not a lot of bad things can happen with implants in 6 months.
That is so true. If you've
Yeah.
made it into your finals, that means that we have determined all of your implants are
Happy, healed,
osseointegrated.
integrated.
They're healed.
Yeah.
Your implants are stable. They're good.
Yes.
And so the warranty that's offered through 3-on-6 and most likely honored by your provider. I can't think of a single provider that doesn't, but they would have the option to opt out of the
Yeah.
3-on-6 warranty.
they do
I just
have the
don't know of
option.
one that's ever done that.
Yeah.
But if you have your 3-on-6 warranty, it states you've got to get your teeth cleaned and have an exam every 6 months.
Correct.
Does 6 equal 7? 6, 7. I
In-
can't believe I just did that
In
on.
our office, we say 7 months, okay. 7 months and 1 day, not okay. Mhm.
So
5 months,
sure,
okay.
come see us more frequently.
Yeah.
So
We have one patient that wants to come see us every 3 months just because he's like, I miss you guys.
Yeah.
Come
So-
on in.
6 months
Mhm,
is how often you have to come in and have your exam
mhm.
and have x-rays
Yes.
taken to maintain your warranty. You just spent $60,000
Mhm.
on a beautiful new smile. It makes sense to take care of it,
Yes.
right? So every 6 months you come into the dentist, we take x-rays, we do an exam.
Look at like an oil change for your brand new car.
Yeah, and we clean your teeth. So what's done at this appointment?
We take a
X-ray?
panoramic x-ray,
Panoramic x-ray,
clean your teeth.
clean your teeth.
Dr. Emett comes in and does an exam.
I do an exam. What do I also do during the
An
exam?
oral cancer screening.
Oral cancer screening.
Mhm.
Just
Which is
check
always
everything.
always fun when you're like, stick your tongue out, stick it all the way to that way, stick it all the way this way. All right, oral cancer screening's negative, and every patient's like,
wait,
you did
what?
an oral cancer screening?
I didn't even know we were
Yeah.
getting that.
Yeah.
So
Lift your tongue up. Mhm.
sometimes life comes up, right?
Yep.
I can't make it exactly at 6 months.
Yep.
I can't make it at 6.5 months. That's fine. You have a 30-day
30-day window. from your 6
leniency
months.
window grace period.
There you go, grace period.
Grace period. You have a
Yeah.
30-day grace period. But at 7 months, you've just gone outside of your warranty zone. So we use 6 months. And this is not just a 3-on-6 thing. This is a general thing in dentistry.
Right.
Because in 6 months, let's say that there was an area in your mouth that was not being adequately cleaned,
Mhm.
or it had some inflammation, or there was some other process going on. These things happen slowly.
Right.
In 6 months, there's not a lot of bad stuff that can happen. I'll be able to catch it on your x-ray or during your exam and be like, hey, whoa, there's an area right here that needs some special attention. And I
We
can
had
do that
a-
every 6 months.
We had a patient that came in for his 6-month cleaning. And we're like, hey, you need this area on your upper left-hand side, on the back side, clean it a little bit better. It's got some inflammation. There's no bone loss yet, but it's definitely some inflammation.
Yeah.
Came back 6 months later. It was clean. The tissue was happy. The tissue
And
was
everything was
healthy.
fine.
Everything was great. And he is religious about those 6 months.
Yeah.
He is like,
But what would happen if we
great.
let that go for a full year?
the inflammation in your gum tissue causes inflammation around the bone, which causes recession around your brand new little implants.
Yeah. So in a year, we can
Yeah.
start to see things happen. And what I
Start
think
seeing
is
some bone loss.
really interesting as a patient, and I have patients in my practice right now who have paid for a brand new 3-on-6 smile.
Mhm.
They get their finals.
And they
I have
disappear.
one I've never seen again.
Yeah,
And I know they live in Las Vegas,
Yeah.
but they have never come back for a cleaning. This has been years later.
Mhm.
So
now he could be being seen at another dental office,
which is fine.
Which is totally fine.
It's totally
Yeah,
fine
totally
with me.
Fine.
But the reality is everything's probably fine.
Yeah.
But
Probably.
if it's not, I haven't had a chance to look at it and tell them if it's not.
Yes.
So are these cleanings expensive?
At our office, they're currently $150. That's your exam, your panoramic X-ray.
That's all
And
of
your
it.
cleaning.
It's not like it's that
So,
plus
yeah.
x-rays or something.
No, to maintain at our office, it's currently $300.
$300 a year.
Yeah.
One,
That may be going up just because materials are becoming
I know.
stupid expensive.
but it's not going to become
It's not gonna be
1,000.
1,000. Yeah.
That's funny. We both go to 1,000. It won't become 1,000. Maybe it will. That sounds like a good number. No, it's gonna.
This isn't an all-on X. We don't have to take it off.
Yeah, you're gonna spend about $300 a year having it maintained. But that brings up an important
That's
thing.
actually a really good point.
That's where I was going to next. It's
Yeah,
on the
there you
list.
go.
So
At your cleanings.
at your cleanings, what do we actually do? So we take the X-ray,
Mhm.
we clean the teeth, we polish the teeth.
Mhm.
You might start to get some staining, but zirconia itself doesn't stain.
Correct.
If you see stain on your new zirconia teeth, it's actually staining of the biofilm layer
Mhm.
that's building up on your teeth.
Yep.
So when you come in for your 6-month appointment, we polish all that off. So you get like brand new, clean teeth.
Sparkly teeth again.
Yeah.
But the bridges don't come
The
out.
bridges don't come off.
Everything stays in place.
And this is one of the reasons why 3-on-6 patients can, for example, have their surgery and their procedure done with me in Las
Whatever.
Vegas,
Mhm.
and then go see their dentist in North Carolina
Mhm.
to have their maintenance done every 6 months.
Yep.
Now, I have a lot of patients who fly back to see me every 6 months. I have a guy right now, maybe he's watching, that drives 18 hours,
Round trip,
Each-
18
or is it-
hours. 18 hours round trip.
18 hours round trip to come see me to have his teeth cleaned.
Yeah.
And I'm like, dude, you don't need to do this. He's like, you're my
Nope.
dentist. I'm
You're my
not going
doctor.
anywhere else.
Yeah.
I'm like, oh, whatever. I love
Well,
it,
and
but
him and his wife don't come here and like party for the weekend.
no.
They literally drive in. He has his appointment. His appointment's an hour long.
They get
or
back in the
less.
car.
They get back in the car and
Road
drive
trip back.
home.
Crazy. All right.
Him and his wife must really like each other to spend 18 hours.
That's a
in the
good
car
point. They don't
together.
just like me, they like each other.
Yeah.
Can we do some
Okay,
questions?
Bailey said it's question time,
Absolutely.
but
Let's do some
when we come
questions.
back to this, we have to talk about the difference between this as an all-on-X appointment.
That sounded like we were gonna have. Yeah, I just bumped my knees. They're bugging me.
Weird.
It sounded like we were gonna go to a commercial break.
Commercial break.
All right, when we come back.
Brought to you by these
Brought to you by
sponsors.
Stella Life.
Start with
Brought
these
to you by
ones,
On Cloud Shoes.
And I'll pull up the Facebook. But start with those ones.
Okay, so we're going to go to the questions right now and we'll catch up, and then Bailey's got some
If
questions.
my rheumatologist saw me do that just now, he'd be like, "Yeah, that should have hurt."
Yeah. Okay, so go back up to what we
All
have
right,
to
so
see.
we're gonna see Luis Rodriguez. I am 5 weeks post-op and
Cool.
still using the baby toothbrush. I purchased the Oral-B IO10, but it feels too strong even on the lowest setting. Can I use a regular toothbrush?
Hold on, let me start with this one. Listen, I didn't do your
Luis.
surgery,
Yeah.
which is fine. I'm glad you're here. That's not what I'm saying. Everybody's case can be a little bit different. So the advice I'm about to give you right now is generalized advice.
Yes.
It may not be specific to your case.
Yes.
But Luis, I don't want you using the super soft toothbrush at 5 weeks out. It's not enough.
Or an electric
The
toothbrush.
problem is your electric toothbrush is too much.
Mhm.
So in my practice, I give you an electric toothbrush at your finals appointment, because when you get in your finals, the electric toothbrush is the correct way to go.
Fantastic.
But between surgery and finals, it's too much. So right now, first 2 weeks only, soft toothbrush. 2 weeks to 4 months, I want you using a manual, soft bristled brush. Will you just go grab one? Do we have one here we can show?
I think I do.
Will
Give me
you-
1 second.
Will you just
I
go
was
find
like,
me?
they'd
I know we
be
have
a-
them. Just
they'd be above a million.
Yeah, just go grab one for me so I can
Come on,
show.
Instagram, you almost fall over.
But between 2 weeks and 4 months, I want you on a manual, means by hand toothbrush, with soft bristles, not super extra soft like this, just regular soft bristles.
But not the electric.
Not the electric. And at your finals delivery, I put you on a electric toothbrush.
Okay.
I like the Oral-B, by the way. That's the one
what they give you.
that's what I give my patients is an Oral-B. This is the toothbrush we give all my patients.
Sponsored by Colgate.
We should get sponsored, right? How come it won't pull that in focus?
Well, 9 out of 10 dentists recommend
Yeah.
toothbrush, don't you know?
4 out of 7.
4 out of 7.
Okay, that's the toothbrush.
It's just a regular, simple,
It's called Ultra
Soft
Soft.
toothbrush.
Slim soft.
slim, soft.
Ultra Soft, right on the top. It says it right up there.
There you go.
Ultra Soft. This is the toothbrush I put every patient on between 2 weeks
and 4 months.
and 4 months. We just give it to you at my office because I
In
want
your
you
go
out there
bag.
on your own buying stuff you don't need or buying the wrong crap.
Yep.
Okay.
In your go bag. So hopefully that answers your question,
Yeah.
Please
Can I
stop
use regular
using-
toothbrush? Yeah, use one.
Please stop using your electric toothbrush. All right,
Unless
Lynn,
your dentist tells you to do something specifically different and then do what that dentist told you to do.
Lynn, may I please ask why we need to wear a night guard after 3 on 6? Yes.
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 Lynn, night guards
Super duper important.
are really important during your healing stage for this reason. It's really common to have a bunch of changes in your mouth and your muscles are trying to find your new bite. They're trying to adjust to the changes. And one of those things that can happen is at night, you're not even aware of it. You'll start to grind your teeth or brux your teeth. And it's this rhythmic motion of grinding your teeth while you're sleeping. Some of this is stimulation of your muscles trying to refine their new position. And some of
Your
it's
new
just
home.
because you've gone through so many changes in your mouth.
Yeah.
And this repetitive grinding pressure motion can cause implant failure and it can cause your bridges to break. So a night guard is simply putting material between your teeth,
A soft, squishy.
a soft, squishy space, so that if you are bruxing or grinding at night, you're grinding on the soft rubber and not teeth on teeth.
Mhm.
So why do you need it in your finals? In your finals, now your teeth are way strong, arguably stronger than your implants. So if you happen to be grinding at night, bruxing your teeth at night, you could easily cause some long-term problems for your new implants. One of the things that's important to keep in mind is this is only on the top. It's not on top and bottom. It's just on the top. And in your finals, we give you at my office a very nice custom high-end night guard that's got kind of a rubbery soft material on the inside and then a
Harder plastic.
harder plastic on the outside. And it's just keeping your teeth from grinding into each other.
Mhm.
What's the number one cause in the world of teeth grinding?
Stress.
Stress. So people that don't grind their teeth can start and stop intermittently throughout life.
And you wouldn't even really know that you're doing it because
Right.
most patients grind at night. They
Yeah,
brux
grind
at
their
night.
teeth while they're asleep.
Mhm.
So the problem can be that, hey, I've never ground my teeth before. And then you're going through a stressful event in life. And all of a sudden you wake up in the morning, you're like, wow, my teeth really hurt. My implants hurt.
Mhm.
You're not wearing your night guard. You have stress-induced bruxism
Mhm.
and you could be endangering your implants. So Lynn, you may ask why people wear a night guard, and that is your answer.
My mom has never been a bruxer ever, but the last 6-ish months. was
She's had a
just-
really stressful
was-
6 months.
Yes, she has started, and it's kind of funny because she's like, I wake up and my jaw hurts. I'm like, you need a night guard. She's like, I don't think so.
Yeah.
My sister went and bought her one because she needed one. She's like, Mom, Tiffany said to use this. She's
Big
totally
difference.
great now.
Yeah. So
Totally
you'll feel it that your jaw muscles are sore, your teeth might ache.
great. Mhm.
You'll wake up. In fact, Bailey grinds her teeth every night.
Bailey, that's behind the camera.
She actually gets
She's a-
injections in her muscles
she's
to
a
help calm it down.
Bruxinator.
But it can cause your jaw to pop and
Yeah.
be sore and get locked open. I'm
Mhm.
looking right at you, Bailey.
Lock open, lock
All right.
close. Yeah.
So that's why we wear a night guard, Lynn.
Wear a night guard. Ashley, any favorite mouthwash for after implant finals?
What do I say to this every time?
No.
No, whatever tastes
Whatever
good.
tastes good.
Whatever
Yeah.
you're going to use.
You don't need fluoride anymore once you have a 3 on 6 because you don't have enamel. So whichever one you like.
Like I hate chloroseptic, or what's the one that Listerine?
I hate
it like
Listerine.
burns my
Listerine is
mouth.
so
I'm a wimp. I can't do it.
The Listerine rep comes in here all the time, and Daisy finally told him, "Bro, we're never gonna have." a
I'm
patient
never
use
giving my
this."
patient that
He's like,
crap.
"Well, this is specific for your gums." She's like, "Does it burn?" He's like, "No." And then we tried it.
It burns.
It
So
burns.
use a mouthwash that's comfortable, but most of the stuff in mouthwash is designed to protect enamel
Yeah.
and promote your healthy natural
Yeah.
teeth. You don't have enamel. You don't have natural teeth. So any mouthwash that you want to use, and the purpose of mouthwash for you right now, there can be some antimicrobial properties. That's totally fine. But it's so your breath smells good and your mouth feels fresh. I don't care which one you use.
Yep.
How likely is thrush after surgery? Wow, Ashley, what a good question you might have
I
asked.
love this question.
Um,
Yes, Dr. Emett, how likely is
one of the things that can cause thrush is antibiotics.
Mhm.
Most patients, if not all, are placed on some form of antibiotic. Overuse, or even some people just general use of antibiotics, can result in thrush. So thrush is likely after surgery. Now, that being said, I've probably had it happen 3 to 5 times.
I can think of two.
I can
three.
only think of 2 or 3
I can think of 3.
in the last 3 years.
Yeah. I can think of
So
3.
it's not like it's going to happen to 1 out of every 10 patients or something.
Oh, no.
But it
just
could.
Small.
It's a non-zero chance.
Yeah.
So how likely is it? Yeah, you could get thrush. Thoughts on using medical grade red light therapy
this.
after surgery 2 weeks post-op? Thanks.
We have a patient who just
Ashley.
asked this exact same question.
And I
2
went down the
weeks ago.
rabbit hole and did a bunch of surgery.
A bunch of surgery.
A bunch of research.
Dr. Emett did tons of research on this. You should have seen the chat that he sent us. It was like this long. I was like, I'm not reading all that. Just
Yeah.
I had AI summarize it.
Here's my official position on red light therapy.
Mhm.
There is no standard protocol that exists right now from the American Dental Association on units, on settings, on surface area, on device, on duration. Can it be a useful adjunct? I think so. And there's some research that says it can be.
Mhm.
There's some research that's been done intraorally with the intraoral thing that goes in your mouth. But none of those research papers that I found were specific to implants in a full mouth reconstruction setting. So you'll find if you do some research, it almost all pertains to gums and soft tissue healing, which is cool. But the long-term impact, benefit, or effect on implants is so poorly studied at this point. I don't recommend it in my practice because there's no standard protocol for it. I think it would be really great if at some point in time,
someone comes out with a research study that says
the day
look,
that
it
somebody
helps.
says
Yeah.
this product, this device with these settings had an appreciable impact on implant healing and recovery, hey, I'm in, right? It's not that I'm anti-red light therapy. I just need it to be.
I use red light therapy.
I need it to be substantiated by the American Dental Association. So yeah, can it be helpful?
Maybe.
Probably. But the other thing is when you look into the research, it's not like patients who used it had advanced healing at 2 weeks instead of 6 weeks. And all of that's anecdotal. Oh, my mom used red light therapy and her healing was way better.
Yeah.
Oh, my aunt used it. Oh, I know a guy that used red light therapy, or, people selling red light therapy. This will dramatically increase your healing times. That's anecdotal. Clinical and research wise, it makes this much of a difference. So there's this added cost, there's this added expense, and the added risk of we just don't really fully understand what it's doing for implants. That's the research that I found from very reputable research places. And the American Dental Association does a really good job of helping find things that are supported and we know will make a difference for patients. And right now their position is we don't have any protocol.
We don't have enough of it yet.
So
hopefully someday somebody will do lots and lots and lots of research.
Intraoral
research
with implants.
Yeah.
Then you'll get my attention.
Yeah. All right. We already kind of talked about this, but is an electric toothbrush preferred?
Yes. In finals.
In finals. Not while you're healing, please.
And I want this one. This one. This is the.
Dr. Emett likes the Oral-B that has the rotating head.
Now it rotates like 1,000,000 miles an hour. It's really fast. But I like that one better than the. I don't want to say the names. I'm not putting it down. Then whatever. We just said it. Then the Sonicare. Also, the Sonicare tickles my nose, and every time I'm brushing my teeth with it, I'm like, whoa, that's too much. It's too tickly. But the one that
you have a sensitive little nose.
The one that rotates back and forth like this really fast, the Oral-B, the circular one, does a really good job getting into the places around your 3-ounce sticks.
We used to have an Oral-B in here.
I gave it away.
Oh yeah, we gave it to Bailey.
I gave it to
we
somebody.
gave it to Bailey. We were looking at it like, this is an actual toothbrush.
That's what I use. That's what we give my patients.
That's what I use. It's what anybody in our office. That's what
I give them all an Oral-B.
So yeah. J-Mo says,
J-Mo.
hi guys, I can't stay. We're taxing off for Houston.
That is
hello, J-Mo.
a airline
Flight attendant.
flight attendant
That
and we
was
talked
on
about her
your live.
earlier,
It
that
was on
has,
your live a couple weeks
yeah, we had
ago.
her on the live a couple weeks ago, that has a portable water pick.
Oh yeah.
Oh
Anyway.
yeah.
You
We-
brought up flight attendant
We
earlier.
got Jay. She's not our only one though.
I know, she's not the only one.
JMO's
She's
kind
mom.
of obsessed with her water pick, which is wonderful. So,
Okay.
and then
Wow,
this
we got a lot of questions today.
guy got milk. Yeah.
So glad I'm
I'm
only 2
only 2
hours.
hours away. Sweet.
All right, Got Milk. We'll
Sweet,
see you
sweet.
soon.
I love got milk. That might be my favorite.
Last week, or 2 weeks ago, the guy,
Oh yeah, what was that guy's name?
uh,
Something Freon.
Yeah.
Freon Leon.
Freon Leon. Yeah.
Okay, I have another question here
Oh,
on
I
Facebook.
just joined the Facebook group. Sweet.
Good.
Post lots of questions in that
Yeah, we'll
Facebook
take care of
group.
that.
You'll have tons and tons
Becky
of
Scheffel.
answers.
Becky, in the beginning of my journey, I was supposed to have 3-on-6 done, but ended up with fake gums and a single arch as my finals because too much bone loss. Will this maintenance be the same for me as well, or should I expect something a little bit different? We have to get right back to, we only have 10 minutes left, and we have to get 15. We have to get back right now to talking about 3-on, or talk. I just turned my mic off, I think.
No, you didn't. It's still
Okay.
good. You're good.
Panic.
I
We gotta
was
get back
told
to
that I
the
will not have to
meeting.
have my arch removed for cleaning. Would love to know what to expect for a case like mine also.
I would love to know where she had it done.
Well, that doesn't matter. Okay, so I'm going to keep this here. There's a lot of pieces to her question. So Becky, are there any up there we have to answer? Okay, so Becky, in answer to your question, one of the reasons that 3-on-6 does not need to be removed is because the teeth go into the gums.
Mhm.
So the gums are forming a barrier now, even attachment onto the teeth that helps keep food, debris, bacteria out from underneath of it.
Mhm.
One of the reasons that an all-on-X needs to be removed at your maintenance appointments is because it's covering over the top of gums. And what it does is it creates a space in here that's virtually impossible to clean without removing the prosthetic.
There's like-
We can shoot some water up in here. We can try to,
There's water picks that have like a curved
yeah,
tip.
we can try to push something up in
Yeah.
here, but you have this gap. Now, common or modern literature and modern technique wants the prosthetic to be convex shaped as much as possible. So it sits on the gums more like this, which
Mhm.
would be easier to clean, but there's still this flat interface here.
You still have a zirconia interface, a little bit of a space, and then your natural
Right,
bone.
where you have this gap
You're gonna have a gap.
where food, debris, and bacteria pile up. So if your prosthetic has that type of an interface where it's not down inside of your gums, where it's sitting on top of your gums, that prosthetic will most likely need to be removed at your appointments. Now, your provider can decide, hey, is this a 6-month removal? Is this a 1-year removal? Depending on who you ask, there's some offices now that are saying, oh, your all-on-X only has to be removed every year. But I can tell you, we've taken them off after only 3 months, and they are stinky.
Yeah.
They're sour tasting to the patient. So I think 1 year is way too long of an interval, but you and your provider can make that decision together.
Yes.
Now, if your prosthetic has to be removed, so one of the big differences between a 3-on-6 and an all-on-X in the post like world living with your prosthetic,
Right.
is you don't remove your 3-on-6. I put these in patients and never want to take them out.
No.
Now they're serviceable. I could take it out. I could drill out the little filling, remove the screw, and take out your bridge, right? That's fine. But every time we take the screw out of a patient,
Mhm.
that puts micro stresses on that screw,
And the abutment.
micro stresses on the zirconia,
Mhm.
and micro stresses on the abutment. Now, we're taught by the company that manufactures the screws that they're single-use screws. Should be used one time, because every time you place it and you screw it down, it creates stretch in the screw.
That's what gives you the retention of the screw.
Yeah, which is a good thing. It creates retention, but it also means that it's not meant for many, many cycles
Off
of this.
on, off on. Right.
If there's a physicist in here, or a, what are they called? The guys that like design, an engineer, they'd be like, yeah, that's totally right. That creates
yeah.
repetition stresses.
So
So
the type of screw that you use is diamond coated, so that it will grab the zirconia
Right.
as it goes down. So every time you're undoing that, you're creating just a little bit of space in that zirconia.
and the
Because the only thing
zirconia.
that's going to remove zirconia, diamond.
right.
Super, super strong.
So every time you take the screw out, you're creating opportunities for failure.
Mhm.
And then you've got to put you should be putting new screws in. These are $30 screws. So if you have 12 screws, well, I guess if they have an
So let's
all
just
on
say-
4.
Well, let's just
So
say
I have
they have an
8.
all on X on the sheet. I think she said just the top. But
Okay, so she has an all on X. Let's just say that
let's
there's
just say there's 4.
4 screws. There's $120 just in screws
Yeah.
that should be replaced.
Yeah.
You've got the time of the dentist to sit and drill out
Taking it out.
all of the fillings, picking out the Teflon, removing the prosthetic. Then we take it out, and now what? Now we got to clean it. Now somebody's got to take that in the back, clean it in a sterile environment.
Correct.
Make sure it's clean and sterile, not sterilized, but clean. Sanitized. Thank you. I was trying to find that word. Sanitized. And then now they've got to bring it back to me. I got to put the thing back
Put it
in.
back in.
Put the prosthetic back in, put new screws in, put new Teflon tape in, do new fillings, and
Adjust the bite
readjust your bite.
Mhm.
This could take me an hour. I mean, we're pretty
I
quick,
say
but
we plan an hour for our 3-on-6 cleanings. I think we've used
30
more like
minutes.
30 to 45 minutes. Most of the time, we schedule a little bit of extra time because we're going to chat with patients because we miss seeing your face, you
Yeah.
know. But usually, an all-on-X cleaning, we don't even do them at our office.
But you
The
can
last time
see,
we did, I think there was about an hour and a half, almost an hour and a half.
yeah, you
start
can
to
see
finish.
why there's some frustrating things that happen in this realm because a patient that has an all-on X done at a corporate office,
Yeah.
and they don't do the maintenance.
We won't say their names, but they might rhyme with Puvia. I didn't say the name.
And beer choice.
And beer choice and Puvia.
So anyway, then you go out in the world
So funny.
and you need to go get it maintained. I know a lot of offices, dentists that go, I don't want to take this patient.
Yeah.
Because I don't have the right, what if I don't have the right driver?
To get the
I don't want to
screw out.
stock thousands
Every-
of thousands of dollars worth of screws just to take care of these patients.
There are so many different types of screws.
Screws,
And-
abutments, and heaven forbid,
Oh my
you're taking off a
goodness.
screw and you
And-
cross thread it when you're putting the new one back in.
And now you stripped the abutment.
And now you got to put a
Now
new
you need
abutment in, and you don't have an implant supply. Like we have
Yes.
cases of parts that fit the implants that we use.
Mhm.
A general dentist may look at this and be like, I don't want to deal with you. And so what's happening is these patients are going out and they're having a hard time finding an office that says, yeah, I'd be happy to take you in
Yes.
as a patient. And then you see these expenses for these cleanings and these maintenance appointments,
I think the most I've ever seen one was $1,800.
$1,800 to have your bridge cleaned every 6 months. Well, compare that to a 3-on-6. I never want to take it out. You come in for your cleaning, we clean around it, we clean off the little gunk and bacteria, whatever, we polish your teeth, clean off the calculus, and we send you back out the door. So could I service these bridges if I needed to? Absolutely. If there's a reason to take it off and do something different, I'll take it off.
Yeah.
But in my office, that's why cleanings are a set price, are $150. Where if an all-in-X, you could be a few $1,000s a year, $4,000 a
As
year
long
taking
at
care of it.
At our office, let's say you had a bridge that was loose for whatever reason,
Yeah.
and you're at the office and we're like, for your cleaning, I'm like, oh, the bridge is
It takes
loose.
me 2 minutes.
Drill it out, take it off. Oh, you need a new screw. All right, it's part of your warranty. Put it back
Yeah,
in.
it's all covered.
It's all covered.
I
As long
have-
as you're coming in every 6 months.
I have all the, and I have cases of this
Oh
stuff
my
here.
gosh, yeah.
So if I had an
We
implant
actually have
problem,
more cases now.
we're getting this from the back. Bailey's like, we've talked about
Bailey's
this
like, "You've
topic
got
way too
5
much.
minutes.
Okay, so that's why every 6 months you have to come in.
Mhm.
Guys, we haven't even started the list of questions.
We've kind of been going
some of them
through
going
them,
through?
though. Yeah, we're going through them. We're just not reading them.
Okay, how often should I have it cleaned?
Every 6 months.
3 to 6 months. Do you take a CBCT ever post-operatively?
Post, like after surgery?
Yeah, well,
Day
no,
after
after you got your
surgery.
finals.
Oh, after your finals.
After your finals.
Only if there's something on the panoramic x-ray that you want a CBCT of, which is that 3-dimensional x-ray.
Yeah.
But those aren't always super helpful in zirconia because there's lots of cast off.
Yeah.
So we always do a panoramic x-ray. And then if there's something that we want to take a little bit of a closer look at, we'll take the 3-dimensional x-ray.
Yeah. Right now, anybody who's watching live, I want you to ask any question you have because we have 5 minutes left to cover live questions. So if there's something on your mind, I want you to ask it now. And then I'm going to explain a technical concept that I think gets skipped over a lot in managing and taking care of maintaining your 3-on-6. and any full mouth reconstruction. So I'm going to start explaining that. But if you have a question right now is your chance to ask it today, because we're only got a few minutes left. So in full mouth reconstruction, we say this phrase a lot. It says, the bone sets the tone, but the tissue is the issue. And I want to explain to you the process by which bone degrades around an implant. There is a distance between your gum tissue and the bone that biologically in your mouth wants to stay the same. Now, everybody's can be different heights, but on average, we're just going to use the number 2.5 millimeters.
What does the textbook say?
Yeah, 2.3, 2.13. So let's just say that it's 2.5 millimeters of distance between the gum tissue and the bone. What happens is if the gum tissue up here starts to get inflamed, irritated, it's got bacteria in it, there's something going on where this is not staying clean and healthy, it releases signals and the bone starts to recede. Well, as the bone recedes, the gum tissue follows. So bone recedes, gum tissue follows. Bone recedes, gum tissue follows. So around an implant, if we're keeping the gum tissue perfectly happy and healthy around the implant, the bone's going to stay perfectly happy and healthy. But if we don't have happy tissue, we're going to start to lose bone around that implant. Again, this doesn't happen fast. It's not going to happen tonight.
Yeah.
But every 6 months, we can catch it. We can watch, say, wow, it looks like we might be losing a little bit of bone around this implant. What can we do to help keep this cleaner back here in this area and help the patient maintain it on their own? Yes. So that's the process in which we could start to lose soft tissue and lose bone around an implant. It all starts with keeping it clean. That's why these appointments and your home maintenance are so important. Mia Huff, is calculus the same as tartar? Is calculus the same as tartar?
Yeah, we
sure.
say tartar on commercials. And
yeah,
and
tartar could be
it's the same thing.
A little bit softer than the actual calculus. The calculus is the really hard buildup. I feel like they always say tartar on commercials, and you say calculus. Just curious. It's all terms used to describe the buildup on your teeth. So tartar, which I hate saying, it sounds like tartar sauce. Tartar buildup is traditionally a little bit softer, and calculus is the hardened kind of
chalky
chalk bit that you kind of like
flick off.
Yeah. Why do we just want to say the same words every time?
Because we work together a lot.
That's got to be what it is. So, good question, Mia Huff. I appreciate that. Bailey, any questions up there we need to address?
I have a question for you.
Okay.
Wait, is there something that they can see, like as they're doing their cleaning and their maintenance, if there's bleeding in their gums?
Yeah. If you're just going along doing your regular maintenance and all of a sudden one day like, oh, I'm bleeding from this area right here, that's a sign that your gums are irritated. That's a sign something's going on.
Get more aggressive with it.
Yep. That is not a sign to shy away from that area.
Yep.
That's a sign we need more cleaning and more stimulation. Get aggressive. If it doesn't go away after a week, come see me. Yeah. Go back and see your provider.
It'll go away.
But yeah.
It'll go away. But
get more aggressive in that area.
It
means a little bit of food or bacteria is stuck right there, causing inflammation. Yep. And if you don't address it, it's going to stay there. So listen, we would love to see you in Las Vegas, obviously. One more question, Ashley. If you do 3-on-6 surgery on someone with infection, how do you avoid or resolve during surgery?
It's all open. We clean out lots of infection this week during surgery. It's all open. Dr. Emmett cleans it all out. We use lots and lots of
frequently patients have infection, and we eradicate it during your surgery.
Yeah, and then you're on an antibiotic afterwards.
Yeah. So deep bone, soft tissue, doesn't matter. I eradicate it during your surgery.
Yep.
All right.
Good question.
So we'd love to see you in Las Vegas. We are a platinum provider, which means we do a lot of these surgeries.
Whoop, whoop.
And
call our office at 702-710-9006. Follow us on all of these bad boys.
That's upside down now.
Upside down.
Who do they ask for when they call in?
Daisy or Amelia. If you ask for me or Dr. Emmett, we don't really know how to talk.
We don't answer the phone.
If I ever answer the phone,
just know that there's a problem.
Something's gone awry. No, I had to answer the phone the other day because Daisy was doing something. And Amelia was recovering.
Like, can you answer the phone? I was like, let's see how this goes.
Hello, I forget to say all the things. So follow us on all these guys.
We have thousands of followers now on these platforms. It's really wild.
Cool.
4 million?
No.
4 million views.
4.4 million views on our videos?
YouTubes.
Come on, that's wild.
That's awesome.
That's really cool.
Way cool. So,
guys, if you have any other questions, don't hesitate to send them to us on social media. We'll find them. We'll get them answered for you. Thanks for tuning in. That's all you need to know about how to maintain your 3-on-6.
But if they join late, can they watch?
Oh, it's going to be available on YouTube here in just a few minutes, and then you can watch. Obviously, it's not going to be live, but you can watch
Yeah,
it.
you can always go
you
back
can
and watch
still
it.
post your questions on that video, and we'll get them.
Do you know that I got asked to do something today and I totally forgot?
What you asked to do?
Bailey said, make sure that you tag a really cool video that just went live or that I mention, because we just put a really, really cool video live, went live yesterday on one of our patients, and it follows her entire journey. You guys, I encourage you.
Amazing. We're hoping she'll be on one of our live.
Yeah, I want to bring her on a live event.
Yeah,
I
she's
encourage you to
amazing.
go find this video right now. It's on YouTube, Bailey.
It's on YouTube.
It's
one of
on
our
YouTube.
long-
It's a long form, so it's like how
couple
long?
minutes long.
It's like 11 minutes.
11 minutes.
long. It's worth it.
It is worth the watch, you guys. You
Yeah.
get to see her story from beginning to end.
She has an amazing story.
And look at her teeth
Yeah.
and when she came in. And I don't want you just to look at her teeth in the end. I want you to look at the human behind the teeth.
Yeah.
I want you to look at the confidence and the difference in the person in the beginning of the videos versus the end of the
She's
video.
the one that came in day after surgery and said that Dr. Emmett's got me acting out. Yeah.
Anyway, just
Thanks,
watch
guys.
that. Super fun. Thanks, guys. Have a good weekend. See you later.
Sweet. Ending